Our lovely patient, who's 31 years old, is about a month out from her MyEllevate, which is a non-invasive neck lifting procedure. And she comes in today with her mom, and she's very graciously agreed to share some of her thoughts and feelings about her entire journey.
I have always been insecure about my neck and not really having a jawline or really a protruding chin. And I just started Googling. At first I thought, liposuction under my chin, maybe that'll take care of it. And I stumbled upon Dr. Claytor, and he offers the MyEllevate, and that seemed to really be what I kind of needed. And I decided to jump and do it scared, but do it because I wanted to. And I'd been waiting a really long time. And I did it the day of surgery. I'm not someone who likes medical things at all, and I feel like if I could get through it, anyone could. Everyone was great. The nurses, all the staff was just fantastic, and I am so happy that I did it.
Awesome. And so let's just go back. So for people who are listening in, I love that overview that you gave. But if you can add in a little bit about what was it that separated liposuction alone versus this combined therapy treatment that we use to help you?
Mm-hmm. I think during this process, what I learned is liposuction would have taken care of the extra fat that I had, but I also had a lot of extra skin that I think would have been left over had I just done liposuction alone. So the MyEllevate was really appealing because it took care of the fat and the loose skin that would have been left over. So I got that really snatched jawline that I was going for, that I don't think that I would have gotten with just liposuction.
Yeah, I totally agree. And I get a lot of patients who come in and say, well, can we just liposuction? And I say, well, sure. But think of it, liposuctioning anything that has no structure or support to it, how do you expect it to recontour up along your jawline? And the lasering, there are lots of different kinds of lasers that people use. And so we need to use it judiciously, which means not too much, because that can turn your tissue into, and I'm touching the exam table, it can turn your tissue into leather or vinyl, and that's obviously not a goal. So we want to tighten it a little bit, and then that suture gives us that structure that holds it. And describe what that feeling is like to have a suture supporting all of this tissue in your neck.
Honestly, all I've felt since after the surgery, it just feels tighter. But I think that feeling lessens and lessens with time that goes by. So now being a month or so out, I don't really notice the tightness anymore. So it really hasn't been anything top of mind lately.
That's exactly the answer that I was expecting you to give, is that you don't really feel it at all. Now, the technique that I've really modified and become highly refined with is that second suture I put in is absorbable. And when you came in 2 weeks ago, you were a little bit puckered up underneath there. And what did we do at that time?
We did microneedling, and that really... You don't see immediate results from that, but as time went on, about a week or two afterwards, I could really tell that helped with the puckering and helped actually, I think, a little bit with the swelling too.
Yeah, for sure. It really softened those areas down, probably started jostling that tissue around those absorbable sutures and helped them even out. Mm-hmm. And I've found this to be extremely helpful for softening those puckerings, but also giving that a little bit of skin tightening to help draw the tissue together. And so now what we have you doing is a little bit of lymphatic massage. And so describe what that's like.
It's very easy. You just put your thumbs under your chin and kind of go out towards your ears and down a little bit. And that is helping with the swelling as well.
Exactly. That's helping the lymphatic channels become re-educated around the suture area. Well, not to give it away, but you've got a big event coming up in about a month or so.
I do. I'm getting married in a little over a month. So this is something that I really, my wedding was kind of the catalyst for me to, just jump in, do it. I want to be able to look back at my wedding pictures and not feel self-conscious about that part of myself that I felt self-conscious about for a really long time. So I'm so glad that I did it, and I'm looking forward to getting my wedding pictures back.
I love it. I love it. Maybe we should rename this the bride-to-be procedure.
There you go.
We'll talk this over with Philly Style magazine, who we do a lot of advertising in their wedding section. But the last question I always like to ask, and I know you drive about 2.5 hours to get here each way, three hours each way. First question is, was it worth it?
It was absolutely worth it. Well worth the drive. I would do it again.
I love it. And that was the next question that I was going to ask. Is this something that you would recommend to a friend?
I would absolutely recommend it. Like I said, I don't like medical things at all. And the fact that I did this and made it out the other side and I'm not traumatized, for me says everything. So yeah, I would definitely recommend it to anyone.
You're fantastic. Well, thank you so much. And since you're so far away, I think we'll follow up virtually so that you don't have to make a 3-hour drive here each way. And I would think we would love to see some wedding photos.
I will definitely send some your way.
Thank you so much.
Thank you.